Good evening. My name's Tim Markle. I'm director of the Wisconsin's Youth Health Transition Initiative out of the Waisman Center. And tonight we're going to talk about health insurance education for teens, young adults, and their parents. I am excited to introduce Tina from Covering Wisconsin. I have attended a training from Tina before, and I've enjoyed learning all sorts of stuff from Covering Wisconsin. And it just seemed like this is something we need to talk about. And how can we help our youth with disabilities who are becoming adults understand about health insurance? And how can we feel more confident in helping them learn about health insurance? And so, Tina, thank you so much for being here today. And you can take it away.
Great. Thanks so much, everyone, for joining us on a Tuesday evening for our webinar training on health insurance education for teens, young adults, and their parents. I'm happy to take questions throughout or at the end of sections or at the end, whatever works for people, if you have questions or anything to discuss. My name's Tina Marshallek. I'm the Community Relations Coordinator for Covering Wisconsin. I will give you an overview into Covering Wisconsin, who we are and what we do. I'm also a health insurance navigator, but I mostly do our partner engagement, our trainings and presentations, and things related to community relations throughout the state. So my agenda for today is to give you an introduction to Covering Wisconsin, who we are and what we do. And then I have an introduction to supporting health literacy, or just an overview of what health literacy is and what health insurance literacy is. Then we'll go over some of the common health insurance terms and concepts that are important for everyone to understand. Parents, teens, young adults alike, everyone. And then I have a section that goes over explaining health insurance to your teen or young adult, which could be applied to explaining health insurance to anyone. But we're focusing on parents explaining these things to teens and young adults today. And then we'll wrap things up with how to stay connected. Covering Wisconsin is a UW extension program that helps people in Wisconsin find and use health insurance. We have been the navigator entity for Wisconsin since 2014 under the Affordable Care Act. All our health insurance navigators are federally and state licensed to help people sign up for health insurance on HealthCare.gov or for Medicaid programs. We're a free program. We don't charge for any of our services, and we serve statewide. In addition to our navigator program, which is our direct service work, we also do education, outreach, and promotions throughout the state. That includes things like this, giving a webinar about health insurance terms and concepts, and doing outreach, attending events, and answering people's questions about health insurance, and promotions about important deadlines and actions people need to take relevant to the marketplace or healthcare.gov or Medicaid programs. Our health insurance navigators can help with many things. We provide free help anytime to understand your health insurance questions, big or small, find plans and financial help to pay for those plans on healthcare.gov, sign up on healthcare.gov or for BadgerCare Plus or other Medicaid programs. We can help with certain billing or coverage problems, or we can help you understand what to do if you are encountering a billing or coverage problem. And we can help find community programs that lower the cost for insurance or medical care when we're helping you sign up for coverage, depending on what the resources are in your area and what you qualify for. And I tend to talk about navigators because that's what my license is and that's who I work with the most. But navigators are not the only type of professional who may help you sign up for health insurance. That bucket is called enrollment assisters. Enrollment assisters are professionals who are licensed to help you sign up for health insurance. That includes navigators. It also includes certified application counselors, and it includes agents and brokers. Certified application counselors are rather similar to navigators, but you're more likely to find them at a hospital or a clinic, for example, and their job might be to help the patients at that hospital sign up for health insurance, versus navigators are expected to do outreach throughout the state and to help anybody. Agents and brokers are also enrollment assisters, but they are a bit different from navigators and CACs. Navigators and CACs can't get any types of commissions or benefits based on anything you do or don't do, and our help is always free. So health insurance help can always be free, and there are many agencies throughout the state who have enrollment assisters on staff. And now I'll move on into the introduction to supporting health literacy. So what is health literacy? The Institute for Medicine defined health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic information and services needed to make appropriate actions regarding their health. So they were defining health literacy as accessing and comprehending information that's important for your health. Now, health insurance literacy is the capacity to find and evaluate information about health plans, select the best plan given financial health circumstances, and use the plan once enrolled. And young adults and all humans need this information someday in order to pick a health insurance plan that meets their financial and their health needs, and to be able to use it confidently so that they can access the health care that they need. These are some skills that can help support health literacy. I want to add a caveat that our abilities with these different skills can vary by individual, and that's okay. Not everybody is going to check all of these boxes, but generally some skills that can help with promoting health literacy include writing, reading, critical analysis, numeracy or mathematical skills, listening, and verbal communication. And for verbal and communication and listening, I'll just connect them together and say communicating. Not everybody communicates verbally. Listening might not be with your ears. Listening can just be understanding what somebody is telling you. And that is that same skill in practice. Now moving on to health insurance terms and concepts. For health insurance costs, there are two different kinds of costs to be aware of. First is the premium, and the second is your out-of-pocket costs. The monthly premium, usually premiums for health insurance are paid monthly. This is the amount that you pay each month to have insurance, even if you don't use it. And second is out-of-pocket costs. This is what you pay for services when you use your insurance or when you go to your doctor. This includes your co-pays, your deductibles, and your co-insurance. And I should add, amidst all of this, I know that for many of you, you know this like the back of your hand. This isn't meant to be excessively an overview for you, but if you're thinking, how am I supposed to make sure that my child someday feels confident in this? I'm giving you a way to explain it. And then I'll go over some ways that you can make sure that your teen or young adult digests that information. So reviewing the different kinds of out-of-pocket costs, the first one to be aware of is the deductible. The deductible is the amount that you need to pay for certain services before the insurance company will start to pay its part. There's a bit of an exception to this, which I'll get to on the next slide. But let's say you have a $500 deductible and you haven't paid it yet for the year. You only need to pay it once a year. Let's say you haven't paid it yet for the year and the healthcare service you just received cost $800. Then you have to pay that $500 before the insurance company starts paying its share of the cost. Then once you meet that deductible, then you're paying a share of the cost and the insurance company is paying a share of the cost. So the remaining $300 on that $800 bill, you subtract $500, you're paying some percentage of it and the insurance company is paying some other percentage of it. For copays and coinsurance, a copay is a fixed amount that you pay for a service, and coinsurance is the percentage that you pay for a service. The copay, because it's a fixed amount, it doesn't vary based on how much a visit costs. So in this example, a doctor's visit costs $20 and you pay $20 and the insurance company pays $80. If you went to a doctor who happened to charge $200 for that doctor's visit, you would still pay $20. Coinsurance is different because it's a percentage. In this scenario, the doctor's visit costs $100. You're paying 30%. That means you pay $30 and the insurance company pays $70. But if that doctor's visit costs $200, then you would have to pay $60. So it's more difficult to predict for people what costs they're ultimately going to have if we're looking at coinsurance. And I mentioned on the last slide that there is a bit of an exception to the deductible. I told you the deductible is the amount that you have to pay in full before the insurance company starts paying a share of the costs. The exception is that sometimes there are co-payments before the deductible for certain services. So you could have a plan where you still have that $500 deductible, but specifically for your primary care doctor visits, you have a $20 copay. And in that scenario, you go to the doctor, you just pay the $20. You don't have to pay into the deductible right away for that service. But for example, if they order blood work and that is subject to the deductible, then you may have to pay into the deductible for that. But that can help higher deductible plans be more affordable for people if there are co-payments before the deductible. Then I'll bring it all together with a final term, the out-of-pocket maximum. This is the most that you are supposed to pay in 1 year for covered health services in addition to the premium. So there are 3 stages to using your health insurance during the year. The first is you have to meet your deductible. You're paying 100% of the cost until your deductible is met for the year. Then once you pay your deductible, you're paying co-payments and co-insurance, and the insurance pays the remainder of the costs. Then, if you hit your out-of-pocket maximum, the insurance company is supposed to pay all the out-of-pocket costs, and you are done paying out-of-pocket costs. Some of you may be sitting there thinking, that's interesting because that's not what happened to me. There is a bit of an exception to this with balance billing. If you're being balance billed, sometimes the insurance company isn't taking that cost, even if you hit your out-of-pocket maximum. So every now and then there is an exception to this, but this is the principle that when you hit your out-of-pocket maximum, you're supposed to be done paying your co-payments and your co-insurance for the year. Another concept to be aware of is networks. It's very important for everybody to understand that they need to be in network if they have a plan where you are not covered if you go out of network. Essentially, insurance companies work with certain doctors, clinics, and hospitals. And if you go to a doctor, clinic, or hospital that your insurance company does not work with, you could be out of network. And if you're out of network, that means that you could be paying 100% of the costs, and it's not going toward your deductible or your out-of-pocket maximum. So it's very important to make sure that you're in network.
Tina,
Sorry. Yes.
while you take a pause, I did have just a note from somebody. If you could just slow down a little bit,
Yeah, of course. Thank you.
that would be great. Thank you.
Yeah, thank you. Sorry, sometimes when you talk about this information all the time, it's da 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 da. I will happily slow down. So it's important to make sure that you are in network. There are different ways to make sure that your doctor is in network. You can call that doctor and confirm, do you take this health insurance? And you can call your insurance company and confirm that your insurance company works with that doctor. There are also often web searches, but it's good to call and verify, even if you're searching in the directory online. And that is typically the way that it works, where you have in-network and out-of-network, that if you're out of network, you are not covered at all. But there are some insurance plans where you can be covered if you are out of network. One example is a preferred provider organization. With a preferred provider organization or a PPO, that allows you to go out of network, but at a higher cost. That could be that you pay $20 to see an in-network provider and you pay $60, for example, to see an out-of-network provider. That's often a popular plan if somebody has an employer that's out of state. For example, if UW-Madison is my employer, but I live in Florida, I may need to pick the preferred provider organization plan because I can't be in network and not in Wisconsin. Something else to be aware of is a drug formulary. Prescription drugs are placed on different tiers, and which tier your prescription falls on affects what it costs. Each tier is billed differently. So traditionally, there were 4 tiers, and I'll explain later that's not always the case now, but traditionally there were 4 tiers that went generic drugs, which were the lowest price, then preferred brand name drugs, which were the next least expensive, and they increase in cost as you go along. The next was non-preferred brand name drugs, and then specialty drugs. Now, especially on HealthCare.gov, we are sometimes seeing that there are more than 4 tiers and things are mixed up a little more than this. Sometimes there are preferred and non-generic drugs, and sometimes there are as many as 8 tiers. So it all depends on your insurer and your plan, and it's important to look at the plan documents to see how many tiers there are and how they're billed. And you can look at the drug formulary and search your prescription specifically to see which tier it falls on. And then you can see how that tier is billed. And when you work with a Covering Wisconsin navigator, we make sure that we check that for you and that it's affordable for you. If you're sick or hurt, where can you go for care? The first step is to consider your doctor's office. Even if it's outside of Monday through Friday, 9 to 5, there is often a nurse on call. If you stay on the phone through that little dial 1 for this, there is typically a nurse on call who you can speak to about whatever your problem is. If it is during regular business hours, the doctor's office keeps appointments like that same week for people who have last minute needs. If you've called the doctor's office before and they said the next available appointment is for a year from now, it's different from scheduling your physical. They do save appointments for people who have more urgent needs. If you call your doctor's office and you talk to that nurse, they might tell you that you need to go to urgent care or the emergency room if it's an important enough thing that you can't wait to see your doctor. Then you may go to the urgent care clinic, and if it's an emergency, please, of course, go to the emergency room. Also, many insurance companies have 24-hour nurse hotlines as well, but typically there's also a nurse available on call through your doctor's office or through an urgent care if you call the urgent care. In considering whether to go to urgent care or the emergency room, please consider that if you have an emergency, please go to the emergency room. But urgent care can be a less expensive option if it's not quite an emergency, but it does need attention. Here are some examples of what urgent care clinics can handle. They can handle earaches, back pain, cough, sore throat, sprains, migraines, minor injuries, minor cuts, minor burns. Emphasis on minor. If I have a sore throat for 2 weeks, I'm going to go to urgent care. If I can't swallow, I'm going to the emergency room. And also consider urgent care clinics do not always have the resources that an emergency room has if you have a real emergency, if you have a 3rd-degree burn. So you may have to end up going to the emergency room anyway if you go to urgent care and it's an emergency. So this is Jax. They're going to help us understand terms. Jax's insurance plan is as follows. They have a $100 monthly premium, a $250 deductible. Their generic pharmacy prescriptions are a $30 copay before the deductible. And for blood work, they have 20% coinsurance after the deductible. And the out-of-pocket maximum is $2,000. This will all stay up on the slides. No need to try to memorize it. And this is a group activity. The question is, how much does Jax pay for their health insurance even if they don't use it? And anybody can shout it out.
Feel free to unmute, shout it out, or you can put it in the chat and I will shout it out for you.
3, 2, 1. It is $100, the premium. So remember, you have to pay this amount to have the health insurance, even if you don't use it. And how much does Jax pay for certain healthcare services before the insurance company starts paying a share of the costs? Anyone want to guess?
Well, if only I had the ability to highlight, I would help people out. Someone's going to go with 2,000.
Okay, it is $250, the deductible. The deductible is what you have to pay before an insurance company starts paying a share of the costs. And how much does Jax pay for a generic pharmacy prescription? Tim, take a guess.
Well, it looks to me like he's going to definitely pay $30. And then more if he hasn't met the deductible, or just $30?
It's just $30. Since the copayment is before the deductible,
Ah,
they only have to pay the copay even if the deductible is unpaid for the year. But if it didn't say before the deductible, if the deductible did apply, then yes, they would have to pay the deductible first. How would Jax be billed for blood work? Not how much would he have to pay, because we don't have that information, or we couldn't derive that from the information provided, but how would Jax be billed?
feel free to unmute or put your answer in the chat, or else I'll have to take another shot at it. All right, I'm going to go with they're going to be billed 20% of the cost of the blood work if they haven't met their deductible, or they're going to pay the full cost if they still need to pay down the deductible.
Yep, exactly. Once the $250 deductible is paid, Jax would pay 20% of the remaining cost, but only up to $2,000 a year, the out-of-pocket maximum. So if they had paid their deductible already, they just have to pay 20% of the total cost. And if they had not paid their deductible yet, then they would have to pay their deductible first, which could just be the total cost of the blood work, depending on how much it is. All right, thanks for playing. Now meet Leslie. She's an artist. Leslie's health insurance plan has a $300 deductible. Diagnostic testing, such as x-rays and blood work, is 30% coinsurance, and her out-of-pocket maximum is $3,000. And I know you all love word problems so much. We have one, and we'll do it together. After getting an x-ray, $500 was billed to Leslie's insurance. She has not paid any of her deductible or out-of-pocket maximum yet this year. How much will she pay in total? So here we have Leslie. We have the terms to her health insurance plan. The first thing she has to do is pay her deductible because she hasn't paid it yet this year. So $500 is the total amount billed. She has a $300 deductible. We know she's going to pay that $300 deductible. We're going to subtract the 300 from the 500 to see how much is left that she has to pay coinsurance on. She has to pay coinsurance on that $200 or what's left after the deductible. So we have to multiply the $200 difference by 0.3 or 30%, and we get $60. And then we have to add her costs. Does anyone know what the costs are that we have to add?
This was um the X-ray, right?
Yes, so this is all for the x-ray, but we have
Oh,
to add
okay.
her cost to find out how much she owes for the x-ray. The
Okay.
question is, which are the costs that we're adding? And I can give the answer if this is perplexing. So she has to pay the $300 deductible, and we found that the amount she has to pay on what it remains after her deductible is paid is $60. She has to pay $60 in coinsurance. So 300 plus 60 equals $360. Then we confirm that her costs are less than her out-of-pocket maximum, which they are. Her out-of-pocket maximum is $3,000, and which means Leslie has to pay $360. And now we have Joey. Meet Joey. Normally I would say you do this one, but this seemed, I think we're tired. I think it's 7:30 at night and everybody's just like, don't make me do math. So I'll do this one too, but people can jump in if they have ideas.
I've been doing so well though, Tina.
Yeah. Yeah. Do you want to do
Okay.
it, Tim?
No, I really have not been doing well. Me and math are not best friends.
You do great. Joey's health insurance plan, the deductible is $500. Medical imaging, such as MRIs, are 20% coinsurance, and the out-of-pocket maximum is $5,000. After getting an MRI, $2,000 was billed to Joey's insurance. Joey has not paid any of his deductible or out-of-pocket maximum this year. How much will Joey have to pay for an MRI? And this is the last word problem. We have the terms of his health insurance plan right there. First, he has to pay his deductible. $2,000 was billed for the MRI. He has a $500 deductible. We know he has to pay the $500. We're going to find out how much remains after he pays the $500 to see how much he has to pay coinsurance on. So $2,000 total amount billed minus the $500 deductible equals $1,500. He has to pay coinsurance on that $1,500. So $1,500 times 0.2, he needs to pay 20% coinsurance, equals $300. Now we have to add his costs and confirm that they are lower than the out-of-pocket maximum. So we know that he has to pay his $500 deductible and he has to pay $300 in coinsurance. That equals $800. $800 is indeed less than his out-of-pocket maximum of $5,000, which means Joey has to pay $800 for the MRI. Now, if Joey does not have $800, what can he do? What to do if you get a medical bill that you can't afford to pay? What I would do with someone in this situation is first call the billing office and confirm the charges. Sometimes people do make mistakes. Sometimes the insurance wasn't billed properly. Something was calculated incorrectly. It's worth confirming. If the information is correct, you can ask to speak with a financial counselor, let them know that you're having trouble paying the bill, and ask to apply for coverage programs or financial help to lower your bill. Some providers and hospitals have financial assistance programs that can help pay for your medical bills based on your income and if you apply. Depending on your income and the financial assistance program, sometimes you can qualify for free care for the entire bill to go away, but you have to apply. And sometimes you don't quite qualify for free care, but you might qualify for a discount on the bill. Please do not ignore bills. It's just human nature. We see something big and scary and we leave it on the kitchen counter. And we're busy and we get distracted by other things. But ignoring bills could lead to your debt being sold to a collections agency. Also, many providers and hospitals allow repayment plans, especially if you're responding within 30 days of the bill. That could be where you're paying the amount over 12 months or 24 months. And typically interest is not applied to that, but it's worth confirming that there's no interest involved. Since I'm talking to some parents of teenagers and young adults, I wanted to address when young adults age out of parents' plans. So young adults can often stay on their parents' insurance until they're 26 years old, but there are some exceptions. If you are on BadgerCare Plus or Medicaid, young adults age out at 19, and then they need to apply for Medicaid on their own. Or if they don't qualify for Medicaid anymore at that point, they need to pursue another health insurance option, such as if they have an employer health insurance available or getting on HealthCare.gov/the marketplace. If you have a military family enrolled in TRICARE, this is a little complicated. You age out at 21 if you are not a full-time student at 21 and you are unmarried. If you are a full-time student at 21 and you are unmarried, you age out at 21 if you are not a full-time student or if you are married. If you are a full-time student at 21 and you are unmarried, you age out either when you turn 23, when you graduate from college, or when you get married, whichever comes first. On HealthCare.gov, if you and your family are on HealthCare.gov on a marketplace plan, young adults can be on your plan until they turn 26, but you need to be claiming them as a tax dependent that whole time. If they start filing their own taxes, then they need to be on their own plan. They need to apply on their own. The reason for that is that only one tax filer can be on a HealthCare.gov application. And for what it's worth, it may be more affordable for the young adult to file their own taxes and have their own plan. Not always, but sometimes young adults are making a lot less than their parents. And then it may be that their cost is their care is a lot less expensive if they're on their own plans and filing their own taxes. And I will pause here in case there were any questions.
Yeah, we do have a question in the chat. I'm not sure if it's going to be best for you to answer it tonight, Tina. I don't know if you could get to the chat with your screen set up or not.
Yeah, I can.
Okay, so the question for Michelle about marketplace advanced premium tax credits. Is that something you can cover
Yeah,
tonight,
let me read it real quick.
Yeah,
I might be able to.
Read it real quick. And I'll go ahead just in case somebody doesn't have the ability.
Yeah, I can answer this.
Okay.
Having marketplace insurance could only reduce your tax refund if your income was not properly estimated on your application. And maybe I shouldn't say it that way. If you estimated your income to be less than it ended up being when you filed your taxes, then you could end up having to repay the difference in the advanced premium tax credit that you would have qualified for at the higher income level. The opposite is also true. If you estimated your income to be higher than it ended up being when you filed your taxes, you could get more money back because you would get back the difference. And if you wanted any help this open enrollment with, estimating your income, you're welcome to reach out to us at Covering Wisconsin and we could sit down with you and help you figure it out.
Yeah, because I can imagine that that's one of those things where you want to get it as darn close as possible. You don't really want to have to pay money, but you also don't want to give away the money and then have to get it back to you. So either way, you want to really be as close as possible. So that's great that there's help available.
Yes, and it's tough. None of us have a crystal ball and we're estimating for the next year. So sometimes people do end up repaying the difference. You can also update your income during the year if your circumstances change. Okay. And moving on to explaining health insurance to your teen or young adult, or really explaining health insurance to anyone, but focusing on teens and young adults. So this is a reminder of the helpful skills that promote health literacy: writing, reading, critical analysis, numeracy, And I like to couple listening and verbal communication into just communicating. Listening doesn't have to be with your ears. If you're paying attention to somebody communicating in ASL, that is a form of listening. And the initial challenge that we encounter when we try to explain something to anyone, especially our child, is how do I know that they actually understand what I'm telling them? Are they digesting this information at all? We all know people may say they understand things even if they don't. They may nod their head very convincingly the whole time, and you go, "Do you understand?" And they go, "Yes." "Do you understand everything?" "Yes." Even if they don't. This is not necessarily due to apathy. It might be due to apathy, but it's not always necessarily that they don't care. It could be that they feel embarrassed. I might argue that in our culture, we may have this idea in our heads that we're supposed to know something that we're being asked if we understand it, and then it's some type of downfall of ourselves if we're saying that we don't understand it, and that's embarrassing and that feels like we're doing something wrong. So as much as we can, understanding where we're all coming from in that, consider that it can be a bit of a red flag that they're not digesting the information if they are quiet or they're not asking very many questions. Typically, people who are trying to understand are engaging with the material as they're going. They're going, okay, so based on this, it would have to look like that. So I have some strategies that can help prevent this, that can help prevent that moment of, okay, you clearly didn't just understand what I said. You're still going to find yourself at that point, though, where potentially where you're trying to make sure that they understand. But I have some ideas for how to improve it. First is remember how numeracy skills are important for promoting health literacy. As we were just talking about math and numeracy skills, many people struggle with numeracy skills. You may need to slow down and show special attention to the math. I have PowerPoint slides, so I'm just yapping away as I'm going through it. But if I was sitting next to a real, one of you in person, I would be writing down these numbers right next to you as I was going through it. The process of understanding how insurance plans work and how much they will cost you is similar to doing complex story problems, like our examples from before. So it's not the easiest thing in the world. And not understanding the cost structure can have serious financial consequences in the future for your team. So here are some tools for engagement with the numeracy skills. First, use specific examples and visuals to the best of your ability. You can use your own health insurance plan as an example of costs if applicable. For example, you can say, okay, we have a $1,000 deductible, and when you had your surgery in February, we hadn't paid it yet, and your surgery cost $3,000. So first we had to pay the $1,000, and so on and so on. Write down the numbers as you're using in your example. If you can have a pen and paper in front of you, the more ways you can engage someone's learning, the more likely it is to stick for them to digest it if they can both see it and hear it at the same time. Especially when explaining percentages, give specific examples because, like I mentioned before, 30% coinsurance only means so much. It could mean $30, it could mean $60, it could be $90. We don't know. So you can show if you visit a specialist and the visit costs $100, you will pay $30. And you could show them with pen and paper in hand, okay, 100 times 0.3 equals $30. If you have a medical emergency and the hospital visit is $10,000, you will pay $3,000. There's also a neat little visual here that I used in my PowerPoint slide that shows a little picture of doctors and nurses and it shows doctor's visit $100. Our culture is very visual. Having something like that can be helpful. This is a piece from our how-to sheet, which is publicly available on our website and in both English and Spanish that you are more than welcome to use. You can use any of Covering Wisconsin's how-to sheet for explaining information. And you can see the little pie chart that can help you see, okay, the insurance company is paying most of the cost. I'm paying this piece. Also, having them engage with writing down numbers as you go can also help them learn. Writing down content, especially math related, helps people learn and also give them specific instructions as you go. We have this example of out-of-pocket costs. It's also easier if you have an image to look at while you describe. Here we have the out-of-pocket cost. This also comes from one of our how-to sheets that is showing the 3 different stages of using your insurance throughout the year. Remember, I explained, okay, you pay your deductible, then you're paying co-pays and co-insurance, then you meet your out-of-pocket maximum, and the insurance pays the out-of-pocket costs. You could use this, for example, and tell them, okay, write down the amount of the deductible, it's $1,500. Okay, now write down the amount of the out-of-pocket maximum, it's $2,500. And it's small, but it can help little things like this stick. If you're using a virtual platform, you can ask that they write it down in the same way that they see it on the screen. Also, using knowledge they already have can help apply this information. You can compare health insurance topics to information they already know. Example, this is a way that you could explain monthly premiums. You could say monthly premiums are like a monthly gym membership or a cell phone plan or your car payment or car insurance. You pay every month even when you don't use it. And if you don't pay it, then you could lose it. So in the example of a gym membership, even if you're not going to the gym, you still have to pay for your gym membership, or else you could lose your gym membership and not have it in the next month when you want to go to the gym. Even if you're not texting your friend, you still have to pay your cell phone bill, or else you might not have a service next month when you want to do it. One of the best ways to ensure someone understood you is to have them explain something back to you. This is called the teach back method. So first, I mentioned before, sometimes we clam up when somebody goes, "Do you understand?" Because we feel like, "Oh no, I can't get it wrong. This is embarrassing. I'm supposed to know." So it can help to try to create a non-judgmental space. You can tell them it's okay if you're incorrect. I'm just trying to help you get it. You can also say, "I know this is a lot of information, and I just want to make sure that you're confident doing this on your own someday. Now, can you explain back to me what a deductible is, what a premium is?" And then let them explain in their own words. They might use a narrative or an example or a scenario instead of a definition. This can actually be a good sign that they're applying the knowledge to real life. Sometimes people are listening for the definition or for exactly what I told you, and then they're describing it differently. That's okay. Listen for their understanding of the concept, even if it's not a recitation of what you told them. Listen to see if they understand how this applies to real life. And here are some examples. Here are some questions you can ask so that your teen or young adult can teach back to you. You could say, what is a premium? What is a deductible? If you signed up for this health insurance plan on your own as an adult, how would you explain how much it costs to a friend? If you're sick and you need to see a doctor, what should you do? What should you say? Especially for people who have important healthcare needs, we may want to teach people how to self-advocate for themselves when they go to a doctor. If you go to a new doctor, what do you need to tell them about your health? You need to tell them that you're allergic to X. You need to tell them that you have X condition and you need Y treatment or support, that you take X medication and you can't have Y thing. And amidst all of that, I mentioned we have all these lovely how-to sheets. You can find them at coveringwi.org/learn. And I think Tim may have been popping some of them in the chat as we've gone along. They really cover all kinds of things. They cover different health insurance programs. They cover how to use your healthcare, what to do if you can't pay your medical bill. All these little infographics I've had throughout my presentation are from our how-to sheets. And you are more than welcome to use them and go through them to help your teen or young adult understand these different concepts. One sheet that can be really neat to learn things is our health insurance options sheet. Your options for health insurance depend on a lot of things, like your age, your income, if you can get health insurance from a job, and more. Each option has its own rules, which is why, we have a flow chart. You can refer to this sheet for a chart of coverage options or work with a navigator to learn about it. And you can walk through the flow chart with your teen to show how it works. Like we have a question here, and when you answer no or yes, it tells you where to go. The first is, do you have affordable health insurance from your job? If the answer is yes, then you need to talk to your employer. If the answer is no, then we look to see if you qualify for Medicare. And then it asks, are you 65 or older or receiving Social Security disability for at least 2 years? Or do you have end-stage renal disease? If yes, go to Medicare.gov. If not, we go on to the next option. So that can help people learn what the different health insurance options are generally. And wrapping things up with some ways to stay connected. You are more than welcome to follow us on social media. We're pretty cool. We work very hard to have relevant and important content. These agencies also have content that can be helpful on these topics: the Wisconsin Office of the Commissioner of Insurance, the Wisconsin Department of Health Services, and HealthCare.gov. And to schedule with a navigator, if you need help with healthcare.gov or with Medicaid, you can schedule with us online at coveringwi.org/enroll. The same tool is available in Spanish. It's /salud. And you can call us, of course. Our phone number is right there. You can also call the 211 helpline if you need help with health insurance. I give them a training once a year on how to handle calls when people are asking for help with health insurance. We also have a web chat. You can live chat with us Monday through Friday, 9 to 4. Outside of those hours, you can request a call back, or you can use our screener, which either directs you toward Medicaid or to healthcare.gov. And if there's any questions, I'm happy to take them. This is my contact information, and our website is coveringwi.org.
And I did verify that I will be able to send this whole PowerPoint out to you all afterwards. So thank you so much for that, Tina, because there's a lot of information in there. One of the things that so Tina, I've talked a number of times, and she's like, "Okay, is this everything? Is this everything?" And so, of course, it takes till tonight that I think of something that I haven't asked, because that's just the way it works. So, just in my experience with my two kids, one of the things that I came across was the fact that my insurance company will send an explanation of benefits. And it looks detailed and it's large and it has numbers all over it. And darn it all, it resembles a bill. And it resembles something like I need to take care of, but I just need to hold on to it. So I'm like, nope, you don't need to do anything with that explanation of benefits. It's just saying this is what they have that your doctor has said that they did. So this is what they're charging the insurance company for. So you want to look it over, make sure that's what you think got done at the visit as well, so that you agree with what was done, but you don't need to pay anything yet. Down the road, you'll then get a bill. And this is where it's really important that if you're getting paper bills, to update your address with your insurance company, with your doctor's office. But that bill then is what you should pay. And it gets confusing. It got really confusing for my kids because this could be months after they saw the doctor before they actually got the bill. And so it's just one of those things that I have to remind my kids, yes, I understand that you saw that you saw the doctor, but you're going to get an explanation of benefits, and then a couple months later, you're finally going to get the bill about what you have to pay. That's the one you really need to pay attention to.
Yes, excellent information. We also do have a how-to sheet on an explanation of benefits that goes over all the different terms that are in an explanation of benefits. And yes, the big point is it is not a bill. There is a question in the chat asking if Covering Wisconsin assists with appeals for medical equipment. We do help with appeals on the marketplace, like if you disagree with a decision that the marketplace made. You might want to reach out to the Center for Patient Partnerships and see if they're able to assist with the appeal for medical equipment. Typically, once it gets to that point where it's between a doctor and a patient, Covering Wisconsin is more on the insurance side of things, or the part of signing up and maintaining coverage.
Yeah. And you might also feel free to, so I put the patient partnerships link in there. I'll also put in a link for ABC for Health. They're um, a public interest law firm, and you can contact them and they may have other ideas as well. Any other questions?
There is a question about if we help with Medicaid appeals. We have in the past helped with Medicaid appeals when the appeal was whether you were eligible for coverage rather than like the coverage itself, for example, medical equipment. The Center for Patient Partnerships also helps with Medicaid appeals. So I would reach out to them on these topics. And so does ABC for Health, now that I think of it.
Mm-hmm.
Any other questions?
Michelle?
Yeah, I'm sick of typing in the chat, so I'm just gonna talk.
Yeah, please go ahead.
Okay, what if the provider had added the wrong codes to like the pre-auth? Like, where do I go for that? Like, that's kind of a complex one that no one can kind of tell me where to go for that.
Sorry, who entered the wrong code?
The provider, the doctor's office, yeah. So what, I mean, what now?
Okay. And the billing office was not able to help and the provider was not able to resolve it?
No, nope.
Okay. Yeah. I am surprised that the provider was not able to resolve it. Yeah, if this is Medicaid, I might go to the ombudsman.
Mhm.
Okay,
Yeah, and if it's not Medicaid, it may be worth contacting the office of the insurance commissioner,
oh,
Yeah.
because
okay,
that definitely should be resolved in my opinion, at the clinic level.
gotcha. Okay, thank you.
Good idea. Any other questions?
Okay. And hopefully some of you have seen we do have a poll launched. This is so that I don't have to track you down and get feedback. So please feel free. Very simple feedback in my world. Were you satisfied, and do you have any next steps? Are you going to apply this anywhere? So please feel free to take that poll as you are leaving. I have no other place to send you. There's no Qualtrics for this one. It's strictly the poll. Um, Again, you will get the PowerPoint, which has Tina's contact information. I threw all the links not all the links, but the Covering Wisconsin site in there. Please check out their site. That's the how-to sheets are all over the place. Scroll down. They're really good. I like the graphics on them. I think they're very easy for me to understand. And again, I am not in love with math. Me and math never were friends. Um, so please use those. Tina, thank you so very much. Thank you all for taking the poll questions or giving the answers. Tina, thank you so much for being here, for joining us on a Tuesday night. I know that we haven't had this training before, so feel free after I send out everything, let me know if we should do this again sometime. Well, it would be in the next year because I know very well that open enrollment is coming up and there will not be any time between November and the end of the year to do anything but help people get insurance through HealthCare.gov. So it'll get kind of crazy. So thank you all very much. Have a fantastic night. Take care.
Thanks, everyone.